It is time for Health Beat. Naloxone or Narcan is a life-saving treatment used if you suspect that someone is overdosing on opioids. It's something that we've talked about a lot as the opioid crisis intensifies. Overdose has claimed many lives here at home as well as across the nation. And just recently, it's become pretty easy to add Narcan to your emergency kit. Our ABC 10 health expert, Dr. Shrishti Sharma, showed me how to administer it because it's a simple thing that any of us can do. Shristi, thank you so much for joining us this morning. So we're talking about Narcan. If I needed to find some right now, where could I get it?
So recently, the government has passed a law that says that Narcan can be made available on all pharmacies. You don't need a prescription to get Narcan. You can just go up to the pharmacist and who will be able to issue it to you. You can also find Narcan in harm reduction centers and other community centers, which provide substance use disorder assistance.
So I can see that you're holding it in your hands right now. It's so tiny, it could probably fit in your pocket or in a purse. Who can administer this? Is there a certain age limit?
People who are exposed to opioids, if you are a bystander, you can administer it. So you can be a family member, you can be friends, or just a regular person walking down the street. If you see someone who's you think that somebody is having an opioid overdose, you can administer Narcan. There has been a study that says about 46% of opioid overdoses are witnessed by somebody. So it's always handy to have one in your purse if you want to help.
So let's talk about how to administer it. So Brandon, our editor here, was so kind to agree to help us with this. Let's do a demonstration. Can you just walk us through?
Sure, yeah. So if you see someone on the ground and they are unresponsive, you can look at their pupils, see that they are pinpoint pupils, they're breathing really slowly, and you think that there's an opioid overdose, then you can definitely go ahead and do this nasal spray. So get on the ground at the chest level, try to wake them up, and okay, Brandon, can you hear me? All right, you do something called a sternal rub, which kind of wakes up a person if they are not ODing on Narcan, or sorry, they're not ODing on opioids. Once you know that they are not responsive, all you do is you tilt their head a little bit, take the Narcan, push it up their nostrils until your finger hits the nostrils, and then just spray. And that's it. Once you're done administering the Narcan, turn the person to the side, fold his arms, yep, and then you can do that. And then if you can bend his legs and straighten the top one out. This is what's called a recovery position. When a person, once you administer Narcan, if the person has opioid withdrawal, if they start vomiting, this will help them from preventing, choking on their vomits.
Right. A big thank you to Shrishti and, of course, Brandon for helping us out with that. Now, a couple of things to remember here. If you feel that the Narcan isn't working, it's very important to make sure that you start CPR. And if you're unsure of if this person is overdosing, you can still give them the Narcan. It's not going to hurt someone who isn't facing an opioid overdose. I did put a link to where you can get Narcan in our area. I just checked this morning. It's about $45 over the counter, and they're also free at some local resources. But of course, the number you can get is limited. You can find all that information right now on abc10.com/links.